Hello, welcome to the National Results Conference of the Vocational Rehabilitation Technical Assistance Center for Targeted Communities. This Technical Assistance Center is a unique and innovative initiative of the Rehabilitation Services Administration, United States Department of Education. The primary focuses of this initiative are to educate the personnel of the state vocational rehabilitation agencies and their partners, such as community rehabilitation programs and community-based organizations. Second is to empower the unserved and underserved consumers the knowledge to increase participation so that they can take advantage of the available vocational rehabilitation services. And the third is to employ these consumers in competitive, integrated employment, supported employment, and self-employment to enhance the quality of life and become taxpayers than tax consumers. Hence, the acronym of the project is E3. I am Madan Kundu, and I have the distinct privilege and honor of serving this 5 years project as a project director. In this webinar, I, along with my 4 colleagues, will provide an overview of the accomplishment of the project since 2015. My colleagues are Mr. John Walsh, Project Manager, Dr. Susan Flower Benton, Principal Investigator, Dr. Timothy Tanzi, Project Evaluator, Dr. Kate Anderson, Project Evaluator. This presentation is made possible with the support from the Rehabilitation Services Administration, U.S. Department of Education. The ideas and opinions expressed are those of the presenters and do not represent recommendations, endorsement, and policies of the United States Department of Education. We want to express our sincere appreciation to Mr. Felipe Lully, Project Officer of RSA, for his guidance in implementing the project and achievement today. Our partners are Southern University, Baton Rouge, Louisiana, a historically black college university, is the grantee. And 5 partners are major institutions of higher education in the country. In Southern University, I serve as the project director. Dr. Susan Flower Benton, the principal investigator. University of Wisconsin-Madison, Tim Tanzi serves as a co-PI. University of Wisconsin-Stout, Mr. Kyle Walker, co-PI. George Washington University, Maureen McGuire-Kuletz, co-PI. University of Illinois, Urbana-Champaign, Dr. David Strausser, co-PI. University of Kentucky, Ms. Christina Espinosa Berg, co-PI. And an advocacy agency, Council of State Administrators for Vocational Rehabilitation, Mr. John Connelly, co-PI. Also, we have a vast network of experts around the country. The purpose of the project E3 is to improve capacity of state vocational rehabilitation agencies and their partners to address barriers to vocational rehabilitation participation and attainment of competitive integrated employment of historically underserved groups of individuals with disabilities from economically disadvantaged communities. Rather than providing training to state VA agencies and the partners, Project E3 has implemented an intensive technical assistance that is provided on-site through long-term service delivery relationships with local VA agency personnel and community-based partners, again in economically disadvantaged communities that is identified by the VA agency. Project E3 outcomes: number 1, increase the participation of state vocational rehabilitation programs. Number 2, increase the number and percentage who complete the VR program and enter into competitive integrated employment. Number 3, increase the amount of community support services provided. Number 4, develop collaborative, coordinated service strategies among state VR programs and community support services agencies to provide with comprehensive service to consumers.
As mentioned by Dr. Kundu in the introduction, the purpose of this Technical Assistance Center is to increase capacity of state VR agencies and their partners to address barriers to VR participation and ultimately the attainment of competitive integrated employment for individuals with disabilities living in disadvantaged communities. Some of the broad factors that we've identified that could serve as barriers for these folks in participating in training programs that ultimately will prepare them for a career pathway include factors such as psychosocial, daily stressors, financial, empowerment, and systems level issues. Some of the psychosocial issues we identified include low expectations, societal attitudes towards disability, lack of soft skills, and a distrust of institutions, especially by folks living in communities that have been traditionally marginalized. In addition, from living in poverty, there are daily stressors, lack of safe and reliable transportation, perhaps food insufficiency, lack of affordable housing, and lack of employment opportunities. We've also seen financial factors such as folks that are receiving benefits, they may fear losing them if they pursue employment. They may also have a lack of experience in working with money and savings and perhaps are not linked into the banking system, and just a lack of employment opportunities within those communities. Linked to that with employment, employers may not often be engaged with the targeted community or the population. In those communities, they may show trends of low educational attainment or lack an understanding about the labor market in general. Lastly, there are some broad systems level issues, including a lack of services and funding coordination, complex systems of public supports that are often difficult to navigate, and lack of capacity to serve the target population that may have complex service needs. When we began this project 5 years ago, we surveyed state VR agencies to find out what were some of the top concerns that were limiting the ability to provide services and to foster economic opportunities for people with disabilities. Top on that list was lack of transportation at 86%, lack of high-quality jobs, pervasive poverty stressors, lack of self-employment opportunities, and lack of employer networks. Project D3 has provided intensive technical assistance to 24 targeted communities in 12 states across the nation. Those states that received our services include California, Illinois, Kentucky, Louisiana, Montana, New Hampshire, New Jersey, New Mexico, North Carolina, Oregon, South Carolina, and Virginia. So what is a targeted community? For the purpose of this project, we've defined targeted community as any economically disadvantaged community that would qualify as an empowerment zone. And in order for that community to be classified as an empowerment zone, the median income has to be below 200% of the federal poverty level. The unemployment rate is at or above the national average. And based on the results of the comprehensive statewide needs assessment within that state, individuals with disability have historically, that have been found eligible for services, have received services or have achieved integrated employment outcomes at 65% or less of the state VR agency outcome level. We also are working within those communities with focus populations, or we call high leverage groups with national applicability. And those groups are groups of individuals with disabilities who have been frequently identified by the state VR agencies as being underserved or unserved, or as achieving substandard performance. Some of these high leverage groups include residents of rural and remote communities, adjudicated youth and adults, youth with disabilities that may be receiving federal financial assistance, culturally diverse populations, folks that are high school dropouts or individuals who are functionally illiterate, In addition, persons with multiple disabilities or folks living with specific conditions such as HIV/AIDS, mental illness, cognitive disabilities, or sensory disabilities. We also had many folks that were receiving SSI or SSDI benefits that were part of this project. I'd now like to turn over to Dr. Flowers Benton, our principal investigator for our TA Center, who will provide additional information on the 4 phases of the project.
Thank you. The states and specific communities were identified. E3 partners then moved in to work more closely with stakeholders at the local level. To that end, Project E3 partners provided intensive technical assistance to these communities in 4 distinct phases over the course of the 5-year project, and each phase built on the lessons learned and the insights gained from the previous phase. So the first phase, community outreach and orientation for target populations, focused on increasing the number of VR referrals and applications from HLGMA groups in the targeted community. The purpose of the second phase, community needs assessment and strategies for change, was to identify barriers to VR participation and employment in each targeted community, with the goal of working collaboratively with community stakeholders to develop strategies to address those barriers. The third phase, training and technical assistance for staff of state VR agencies, community rehab programs, and community-based organizations. Project E3 partners began to offer training and technical assistance aimed at improving the capacity of service delivery professionals to provide VR services and comprehensive support, as well as to expand employment opportunities for target populations. And then in the fourth phase, sustainability and systems change, the project focused further on developing and strengthening those collaborative relationships, both with and between community stakeholders. And this was done with the goal of building the community-based organization and community stakeholder capacity to leverage their available resources to overcome some of the barriers that might be considered outside of the scope of VR services that we had previously identified, such as lack of housing, lack of transportation, food insecurity, inadequate healthcare patterns, and other systemic barriers to VR participation and employment. The primary focus of phase 1 was to increase the number of VR referrals and applications from HLGNA groups in the targeted community. This was achieved through outreach to community-based organizations, as well as to potentially eligible individuals. This two-pronged approach served to both increase the awareness of VR services in these communities and to increase the community-based organization's capacity to identify and refer potentially eligible individuals. For example, as a result of outreach to community-based organizations, one Project E3 partner developed a referral screening tool for use in the Chicago TC, which is also available for use in other communities. Outreach efforts to individuals included orientation sessions that addressed the general lack of awareness of VR services and procedures, as well as issues specific to the community, such as lack of trust. All outreach activities in each TC were adapted to fit community needs, and other examples of these include public service announcements that were specifically tailored to reach prioritized populations, and targeted outreach such as community forums, listening sessions, social media posts, radio interviews, videos, podcasts, literature distribution, and all of these were done in accessible formats. One great example of how outreach efforts were specifically tailored to reach members of an HLG community come to us from community partners in California. There, members of the Hmong community were identified as a population that the VR agency wanted to better serve. Based on feedback from community leaders, public service announcements were broadcast in at the Hmong language radio station to promote awareness of VR services in the state and to ultimately increase applications from members of this community. Community-based participatory research is a relatively well-known research approach that emphasizes the importance of engagement and collaboration between researchers and the community for whom the research or the program or whatever it is that researchers are developing is ultimately meant to serve. Project E3 used elements of CVPR at all phases of the project. E3 partners worked in collaboration with community stakeholders to determine their needs and to identify and implement the most appropriate strategies to address those needs. To that end, in addition to conducting literature reviews of emerging, promising, and evidence-based practices, E3 partners also enlisted the help of community experts through semi-structured interviews, hosting focus groups, listening sessions, convening advisory councils comprised of key VR and community stakeholders. And though each state and community identified different needs, there were some specific areas of low overlap, which included lack of general awareness of VR services, and this is on the part of the potential consumers and community-based organizations, and then a lack of relationship between these organizations and VR. And then there were also external barriers that were identified previously. So through this collaborative work with VR and community stakeholders, E3 partners then developed specific training and technical assistance activities designed to address these needs that were identified in the previous phase. These trainings and technical assistance were then offered to staff of VR agencies, CDOs, and community rehab programs, and in some cases directly to the members of the HLGNA community themselves. Training and technical assistance activities generally covered 4 broad categories, which were 1, training on issues of specific concern to the HLGNA populations located in each TC. For example, providing HIV, AIDS, and mental health awareness and substance abuse training to participants and to counselors. And then there were trainings on HLGNA specific issues that potentially impact service delivery. For example, trainings on understanding the intersection of disability and poverty and trauma-informed care. A third category included training and activities that encourage collaboration between community stakeholders and increase the coordination of service strategies and potential system-wide changes, such as introducing and implementing the integrated resource team model and teaching counselors and administrators to learn how to grade and leverage resources. And then the fourth category is training and activities that encourage the expansion of employment opportunities for HLGNA populations. Activities in this category focus on employer engagement, business development, grant writing, and self and home-based employment opportunities. So here's a non-exhaustive list of just some of Project E3's training and technical assistance activities. As you can see, some of the activities focus on providing training and services directly to members of the HLGNA community, such as mindfulness, stress reduction, impression management training, financial literacy and empowerment training, and job club. Other trainings were offered to staff of VR and CDOs in order to increase rapport building to improve employment outcomes, such as motivational interviewing and trauma-informed care. And many of these trainings and more have been recorded as webinars and posted to the Project E3 website. So the fourth phase, which is sustainability and systems change, has been an ongoing activity throughout the life of the project, but the focus has really now shifted in this direction as we begin to evaluate the impact of the project on the communities that we have served. At the state and local level, long-term planning has really ramped up since the first Leadership Academy was held in New Orleans in September of 2019. VR staff and staff members of community agencies of all 12 states and 24 targeted communities were invited to this 2-day event to gather and learn from each other and to prepare sustainability plans for continuing the work begun by Project E3. To complement and further enhance the work begun at the Leadership Academy, an additional community of practice was established at the end of year 4. This community of practice is comprised of key leadership in all 12 state projects. The community of practice meets monthly to share information and to continue project change efforts and promote the sustainability of those changes. A great example of how Project E3 activities have translated to changes at the state level can be found in Virginia, where Project E3 received support from the executive leadership of Virginia Guards to facilitate a statewide rollout of the lessons learned and the emerging practices in 5 regions across the state of Virginia. Managers, unit supervisors, counselors, support staff, and placement counselors are being recruited to participate in this 6-part virtual training series covering the following topics. Counselors and participants will talk about intersections of disability and poverty, partnership development. They'll talk about elements of CBPR and shared consumers. They'll be participating in a community academy. They'll also learn more about integrated resource teams and how to implement those in their communities, and community financial empowerment. And following this virtual training experience, the selected staff members will function as E3 influencers within their organization, following a train-the-trainer model. In terms of sustainability at the national level, we have several mechanisms for sharing the information that we've learned and the tools that have been developed. So, of course, Project E3 has a website where you can find specific information about each partner and their populations and the areas of focus. There are also universal technical assistance efforts and Project E3 webinars on a variety of cutting-edge topics, which my colleagues will touch on later in this presentation. There are also our series of results webinar, of which this is the first, and of course, the information, webinars, and toolkits that have already been posted and will be posted to NCRTM in the future. So as I just mentioned, Project E3 has recently begun project evaluation activities, and we're already seeing preliminary evidence of the positive impact that these activities have had in the targeted communities, especially on the relationship between VR agencies and community-based organizations. According to partners, they've received feedback from VR agencies and community organizations indicating that the strength and the quality of partnerships have increased tremendously. And additional reports indicate an increase in inter-organizational collaboration as well. So community-based organizations are beginning to work with each other more as well. There's also a sense of increased recognition of the role and importance of employment and the consumer's ability to maintain their health and quality of life. For instance, in New Orleans, a community organization that once focused primarily on immediate health and prevention needs and issues recently applied for and was awarded a grant for which they included employment services. And this is something that is a direct result of the work of E3 partners and consultants. Partners have also indicated that VR agencies have received increased quantity and quality of referrals. The training and technical assistance opportunities that have been a part of Project E3 have led to increased opportunities for partnerships between VR and community-based organizations and the potential to last long after the life of Project E3. So already there are indications that these improved relationships between the two organizations may be positively impacting consumer engagement and retention in VR. So overall, while there are still more evaluation activities planned, partners cite that intensive technical assistance activities and training appear to be an important mechanism for providing opportunities for counselors and CBO staff to connect, deepen relationships, problem solve, and address barriers while at the same time build and improve professional skills to better serve their consumers. And with that, I will turn it over to Dr. Tim Tansey, who will talk to you a little bit more about the trends that we're seeing.
Project evaluation was based on data from multiple sources. Central to our project evaluation was quarterly RSA 911 data that enabled the project to track performance on a regular basis. RSA 911 data was held in an online data management portal, Salesforce, that allowed the project evaluators to conduct data analysis on outcomes for each quarter, as well as compile custom reports for project partners. Other sources of data for project evaluation were quarterly reports provided by partners on ITA activities, surveys from participants in trainings and other initiatives, as well as documentation provided by state VR programs and community agencies to highlight formal changes in service collaboration and coordination. The outcomes identified for the project was to work with individuals with disabilities from low-income communities towards increasing participation in state vocational rehabilitation programs, increasing the number and percentage of individuals with disabilities served through the state VR programs that exited in competitive integrated employment, increasing community support services, and attempting to develop collaborative coordinated service strategies among state VR programs and community support services agencies and systems to provide more comprehensive services. From July 1st, 2017 through December 31st, 2019, the Targeted Community Technical Assistance Center has worked with state VR agencies in 12 states to increase representativeness of high leverage groups of national applicability in targeted communities. At the time of this presentation, 2,603 individuals from the specific groups of interest in these communities applied for services as of program year 2019, quarter 2. Of this sample, approximately 97% were found eligible for services. However, of those found eligible, only 69% had an IPE developed, and approximately 91% of those with IPEs were ultimately served. Of note, as the time from application to closure is generally beyond 700 days, many of the individuals that applied during the course of the project are still being served by the VR programs. Likewise, the finding that almost one-third of eligible applicants lacked an IPE during the project will be discussed in the following slides, and the relative impact of this finding on subsequent applications by HLG&As in these communities. This graph shows the proportion of HLG&A applicants to the total number of applicants in the TC and in the states receiving ITA in the project. The graph indicates a relatively stable proportion of applications of HLG&As in both specific TCs as well as the entire state of those state VR agencies served under an intensive technical assistance agreement. However, the proportion of HLG&As in the TCs appear to outpace the proportion of HLG&A applications in the rest of their ITA states through the end of project year 2018. The proportion of applications by HLG&As in the TC being determined eligible increased almost 5% over baseline. They were 7% more likely to be found eligible than HLG&As served in the rest of the state. It is noteworthy that although HLG&As in the TCs were more likely than applicants in other parts of the state to be determined eligible, a simple comparison indicates that, on average, HLG&As were 3% more likely to be determined eligible in the TCs than in the rest of the state. This indicates a greater specificity in outreach efforts to HLG&As, resulting in an applicant pool more likely to be found eligible than existed elsewhere in the states receiving ITA. The proportion of HLG&As and TCs with IPEs also outpaced those in the rest of the states with ITA agreements. The growth in proportion of those with IPEs was retained through 2018. Of note, due to a number of factors, including potentially order of selection, the proportion of those with IPEs is less than the proportion of those determined eligible. That is, toward the end of 2017, we observed the start of a decrease in the percentage of eligible applicants that were served under an IPE. The decrease in percentage of those with an IPE appeared to facilitate a corresponding decrease in application in subsequent quarters among HLG&As. Similar to the percentage of individuals with IPEs, the proportion of HLG&As in TCs served under an IPE also outpaced those in the rest of the states with ITAs. The growth in the proportion of those served under an IPE in the TCs, though decreasing in overall proportion through 2018, was served at a higher rate than HLG&As in the rest of the state through 2018. Again, of note, due to a number of factors, including order selection, the proportion of those served under an IPE is less than the proportion of those determined eligible and those with IPEs. The previous slides provided aggregate data across all 12 ITA sites. However, as noted earlier, there was a decrease in the percentage of eligible applicants who completed an IPE and were subsequently served under that IPE. One potential explanation is the impact of an order selection that was implemented in different state VR programs. The three graphs on this slide show the corresponding changes in the proportion of the HLG&As in the TCs across 3 time periods. The first graph represents the 3 state VR programs that were not under an order of selection. The second graph represents the 7 states receiving ITA that were under an order of selection with at least one category open. The third graph represents the 2 state VR programs receiving ITA who were under an order of selection with no categories opened. As noted in the graphs, among states without an order of selection, although the proportion of applicants is slightly down and the percentage found eligible is approximately the same over time, the retention of HLG&As in service categories has increased across the project. Among states with an order of selection, but with categories open, there was a clear increase in those with an IPE in receiving services going into 2017, but yield those gains in 2018. Lastly, in those states with an order of selection and all categories closed, despite modest increases from 2016 to 2017, all GEPRA-A measures declined through 2018. There were two specific outcomes of interest with regard to competitive integrated employment. First, we were interested in increasing the number of participants achieving competitive integrated employment outcomes in the targeted communities. Second, we were focused on increasing the employment rate among HLGNAs in these communities. In reviewing the total number of closures after an IPE and employment, those served in the TCs appear to show a reversal of a downward trend that began in 2017 to an overall increase going into 2018 and continuing into 2019. In general, HLGNA populations served in the TCs, although being comparable through 2017 and early 2018, grew to an almost 10% higher proportion of those individuals closed after an IPE and employment than HLGNAs found in the rest of their states. In evaluating the employment rate of HLGNAs in the TCs to the HLGNAs served in the rest of their states, the overall gap in employment rate between these two groups decreased from approximately 16% to less than 1% in 2018. The HLGNAs in TCs employment rate increased by 10% during the project, although an increase of closer to 3% was observed in the most recent time point. The HLGNAs in the rest of the state generally declined from baseline through 2019, although all groups declined slightly from 2018 through the end of 2019. In summary, the aggregate data shows increases through 2017 across application, eligibility, IPE, and service measures. However, the data also suggests a decline in applications in early 2018 and subsequent declines in eligibility and other service measures. Although additional analysis is required, these declines appear to follow changes in orders of selections in several ITA states. However, during this same time, the percentage of HLGNAs closed in employment, as an overall proportion of those closed in employment, increased at a greater rate within the TCs than in the rest of their states. Likewise, the gap in employment rate between HLGNAs served in the TCs compared to those served in the rest of their states substantially decreased during the project. Subsequent analysis on the impact of ITA services, state VR environmental factors such as an order of selection, and community variables is needed to understand the impact of the project and identifying best practices for future services. And with that, I will turn this over to Dr. Kate Anderson.
Various community support services were measured regarding community building, leveraging available services and supports, and increasing connections with vocational rehabilitation agencies. Specifically, we measured the number of organizations providing direct support services as a result of Project E3 capacity building training and technical assistance activities, the number of formal comprehensive supports partnerships among VR agencies, community rehabilitation programs, community-based organizations, and other organizations that were initiated through Project E3 actions. Examples of these include formal agreements, contracts, and documented policy changes. We also measured the number of organizations involved in partnerships that were initiated through Project E3. Between years 1 and 4 of the project, the following increases were demonstrated. The blue line denotes the number of new organizations providing direct support services to VR consumers as a result of Project E3, which increased by 67. The green line shows the number of formal comprehensive partnerships among VR agencies and other community partners achieved through the project, which increased by 27. And finally, the orange line shows the number of organizations in less formal partnerships with VR agencies, which increased by 255 throughout the project. Knowledge translation and engagement measures were also an important part of the Project E3 measurement and evaluation strategy. The data on the left side of the slide helps illustrate various engagement strategies measured during the project, specifically webinars, website sessions, and social media, including Twitter impressions and Facebook reach. Participation across the various forms of training and engagement increased each year. And specifically, the spikes in Twitter impressions were closely linked with an implementation of webcast information in years 4 and 5. Specific examples of the spikes were closely related to information and training around Social Security benefits and work incentives. The data on the right side of the screen provides a closer glance into webinar participation rates based on registration and attendance. The industry norm for percentage of registrants who eventually attend webinars is typically between 40 and 50%. Project E3's percentage has exceeded the industry norm for each of the webinars to date, averaging approximately 69%. This indicates that the topical content was relevant and of particular interest during this period of time with these communities. The top 5 webinar topics gaining the highest registration and attendance rates were customized employment and a focus on discovery process fidelity, trauma-informed care, disability and poverty, and has been mentioned earlier, specifically the intersection of disability and poverty. Social Security benefits with a specific emphasis on working with individuals receiving supplemental security income, SSI beneficiaries, as well as motivational interviewing. And communities of practice were mentioned earlier in this presentation. In addition to the leadership COP that was discussed, Project E3 also had broad-based communities of practice covering a variety of topical areas. This COP was facilitated online and open to anyone interested in joining who would like to connect, learn, and share resources. The framework for the COP was built during the initial phases of the project, and once we started actively disseminating information about the COP in year 3 of the project, participation rates increased rapidly, currently with a total of 1,392 active members, and we average about 71 new members each month. The information shared on the right side of the slide provides more detail regarding who's been participating. It's important to note that about 36% of our participants identify as VR personnel employed through state agencies, and about 25% identify as community service providers, which is exactly what we wanted to see. And the COP serves as an opportunity for VR personnel and community providers to connect with each other, share resources, and learn with each other.
We have heard from my colleagues that all the project activities and accomplishments. You may have participated in some of the activities. If not, all these informations are available on our website. So I'm going to the targeted communities profile, describe the targeted communities and their priority population in each state, including area unemployment and poverty indicators, population characteristics, and strategies to address barriers with contact information for the E3 partners in each community. Webcast includes 32 archived webinars on evidence-based practices, promising practices, and emerging practices that are effective when working with our underserved and unserved targeted populations free of charge. Certified Rehab Counselor continuing education credits are available for each webinar at no cost. New webinars are being produced and added to the site. Please register for one of our webinars today. Resource library, it allows you to search the project website by keyword, by population served, and by the community. Strategy to help link the field to relevant resources and readings. New content is added regularly. Research summaries. At a glance, plain language research summaries to link busy professionals in the field with academic research into evidence-based practices. A clear understanding of research in the field by topic. Quick reads with information that can be applied to daily practice. Resource roundup. provides up-to-date information on a variety of topics, including a link to our counselor toolkit, COVID-19 resources, and many other topics. Strategies to address barriers includes information on evidence-based practices such as job clubs, financial literacy, training, motivational interviewing, customized employment, and more. Organized by strategy, it can be used to apply the strategy to daily practice. Community. To sign up for online communities of practice where professionals meet to share ideas, discuss strategies, and evidence-based practice application, including communities on rural and remote services, disability and poverty, career development and employment research, and social security benefits and employment. Please join today, share your expertise, and learn from others. Coming next is our evaluation plan, follow-up webinars, final report, and additional tools. We have a list of tools developed on E3 website, but there will be new ones will be added. Those are customized employment and integrated resource team. In conclusion, what this project means to us, when we developed this project proposal, we had many unanswered questions. We knew that we would be swimming in uncharted territory. At the end of the 5 years project, we must say that we are more affluent in the knowledge of unserved and underserved people with disabilities and their plights and struggles to survive, how to help them to become contributory citizens of the society. These are the people who have HIV/AIDS, substance abuse, mental health conditions, foster care, people who are incarcerated, people with multiple disabilities, culturally diverse, and others. Project E3 has provided new knowledge and skills to state vocational rehabilitation agency personnel, community rehabilitation programs, and other community-based organizations. This knowledge is helping them on how to collaborate, how to outreach this population, and how to harness available resources in the best interest of these consumers, and thereby enhance employment outcome and quality of life. If you have any questions regarding this presentation and would like to learn more about the project, please contact us using the phone and email address given in the slides. And also, please visit our website, projecte3.com. Thank you for listening to this webinar.